This is Duke University.
The goal of the study was to try to determine whether we can do something about obesity in a group of people that has the highest obesity risk in the world. Even though we've seen a leveling off of the obesity epidemic in the United States, this group, by and large racial ethnic minorities, lower income individuals, have an incredibly high risk of obesity and an incredibly elevated risk of experiencing obesity-associated diseases like diabetes and cardiovascular disease. So the primary goal of the study was to try to determine whether or not we can treat obesity successfully in this group, because most studies that have been conducted before it have had a lot of difficulty promoting the large weight losses that are needed to offset later life health risks. It was really important that we conducted this study in the primary care setting. And the reason for that is that traditionally primary care providers have not offered a lot of obesity counseling to their obese patients. And there hasn't been a lot of information and a lot of intervention or treatment strategies that providers have used in the primary care setting. So a major goal of this study was to determine whether or not we can do something about obesity in the highest risk population in the primary care setting, which is where a lot of people think they should go for information about how to lose weight and prevent obesity-associated diseases. So the study was a 2-year intervention, and our participants used IOTA. IOTA is the Interactive Obesity Treatment Approach. It's a weight loss strategy that we developed here at Duke, and it utilizes advanced technologies like websites, mobile apps, interactive voice response. And they use these technologies in order to monitor how well they're doing in their weight loss efforts. So after this 2-year period, we saw relatively modest weight losses. But what was important about the study was that most times when people lose weight, they gain the weight back. And in most studies of weight loss interventions, people lose the most amount of weight at about 6 months, and then they gain it back over the next 6 months. Our study was a little different. People didn't lose a large amount of weight at 6 months, but the weight that they lost, they kept off for a 2-year period. And that's really important because we know that stopping weight gain is an important strategy in preventing obesity-associated diseases. Most people gain weight year after year after year. So if we can do something to stop those weight gains, then we can prevent hypertension and diabetes and a range of other conditions that are associated with obesity. What was more important than that was that we saw large blood pressure changes. So we saw blood pressure changes that are clinically significant, and given that everyone in our sample was hypertensive, these blood pressure changes were really meaningful to their health.
Produced by Duke University. Online at duke.edu.